Pnawn da. Eluned dwi, Gweinidog Iechyd a Gwasanaethau Cymdeithasol yn Llywodraeth Cymru, a heddiw yn ymuno gyda fi mae Dr Gill Richardson, Dirprwy Brif Swyddog Meddygol ein rhaglen Brechlyn Covid-19. Diolch i chi unwaith eto am ymuno gyda ni. Thanks for joining us again. Last week we updated you about the emergence of the new Omicron variant and the actions we've immediately put in place to respond to it. Cases of Omicron are growing daily. It's now present in every health board area in Wales. We must be prepared for cases to rise very quickly and very steeply. Every day, we're learning more about this incredibly fast-moving form of coronavirus, which emerged just 3 weeks ago in South Africa. The latest evidence, which was published over the weekend, is about the effectiveness of our vaccines. Now, I'm going to ask Gill to explain more about this in detail in a moment, and then I'll explain what we're doing to accelerate our booster programme even further. Ein bwriad oedd I gynnig apwyntiad I bob oedolyn cymwys erbyn diwedd mis Ionawr. I ni nawr yn anelu at gynnig apwyntiad I bob oedolyn cymwys erbyn diwedd mis Rhagfyr. It was our intention to offer all eligible adults an appointment by the end of January. We are now aiming to offer all eligible adults an appointment by the end of December. Gill.
Thank you, Minister. Diolch yn fawr. Researchers around the world are rapidly investigating Omicron to learn more about why it is moving so quickly, whether it causes a more severe form of illness and how it will behave as it spreads into different countries. Over the weekend, preliminary studies emerged indicating that both AZ and the Pfizer vaccines may provide lower levels of protection against symptomatic infection compared to the protection they provide against Delta. But protection improves considerably after a booster dose. What this means for vaccine effectiveness against severe disease from the variant is still emerging. But the message is clear. 2 doses of the vaccine may not be enough to protect us against Omicron. We all need a booster dose to increase our protection against the virus. We also need to protect our NHS at this time. It is already under significant pressure responding to winter illnesses, caring for people with COVID and catching up with treatments which were delayed earlier in the pandemic. Since this study emerged, we've been working with the NHS to update our plans to increase the speed of the booster programme. This will be a priority for the whole NHS. I would urge everyone to make getting your booster your #1 priority. It will be one of the most important things we can all do to protect ourselves as we prepare for this wave of Omicron infection. Of course, it is never too late to be vaccinated in Wales, and if you have not had your first or second dose, please make arrangements to come and be vaccinated now so that we can start your course of vaccines as soon as possible. Minister, I'll hand back to you.
Diolch yn fawr, Gill. Hoffwn fynegu niolch I bawb sy'n gweithio tu ôl i'r llenni, gynllunio ein rhaglen frechu ac i'r miloedd lawer o bobl sy'n gweithio mewn clinegau brechu ledled Cymru. I want to put on record my thanks to everyone working hard behind the scenes to plan our vaccine programme and the many thousands of people working in vaccine clinics throughout Wales. As Gill said, increasing the rollout of our booster programme to maximise protection is now the #1 priority for the NHS. We've been working with health boards since the weekend to make changes to the vaccination programme to go further and to go faster. And this will mean the focus of the NHS will need to shift towards vaccinating people for a short time. The NHS will continue to provide essential services, emergency and urgent care. But we will be redeploying all available clinical staff to vaccination centres. We'll be asking them to work in existing mass vaccination centres, which will be expanded to their maximum capacity and also in new centres. Many of the centres will be expanded to have dedicated walk-in lanes, and we'll be targeting these walk-in slots at particular groups of people. We'll be looking at expanding existing opening hours. Centres are already open from 9 a.m. to 8 p.m. This will mean asking NHS staff to vaccinate from early in the morning to late into the night to make sure as many people as possible have the extra protection the booster dose offers. We've already taken steps to accelerate the vaccine programme. Today's figures show a big increase in boosters given, and more than 1.1 million have already had their booster. Hundreds of thousands of appointments have already issued, and these appointments will remain in place. But in the coming days, we'll be texting or phoning everyone whose number we have, who has already had their first and second dose, to offer them a booster appointment. As well as giving people appointments, we'll also be asking some people to come to a walk-in slot at one of the newly extended vaccine clinics. We'll continue to call people forward in order of risk. Expanding the booster programme is a massive undertaking. We'll need to more than double the speed of the programme if we're going to be successful. We're asking a huge amount of the NHS. We're asking staff to cancel leave and to work in clinics day and night and through Christmas to vaccinate hundreds of thousands of people in a matter of weeks. Cefnogwch y gwasanaeth iechyd drwy roi blaenoriaeth I gael y pigiad atgyfnerthu. Dyma'r peth gorau gall pob un ohono ni wneud I amddiffyn ein hunain rhag yr amrywiolyn Omicron. Please support the NHS by making getting the booster your number one priority. It's the best thing we can do to protect ourselves from the Omicron variant. I want to be clear, however, that while vaccination is our best defence against coronavirus, we will need multiple layers of protections and measures in place to keep Wales safe from a large Omicron wave that's heading our way. We have already taken steps to increase protection in Wales, but we're likely to need more as the variant becomes embedded in our communities. If we do need this, we will keep you updated. Diolch yn fawr I chi gyd. Gill and I will now take questions from journalists, and all questions will be broadcast on our social media. So the first question comes from Jenny Rees, BBC Wales.
Thank you. Good afternoon. Can I clarify one point? Is this an offer of a booster by the end of the year or the actual booster by the end of the year? I mean, if it's the offer, how long after the offer can you expect people to have the jabs in their arms, if you like? And if I could have that answer in Welsh as well, please.
Jill, would you like to take that?
Yes, certainly. So it is an offer, Jenny, that we'll be making, and there's a reason for that. There are some people that aren't eligible even for their booster dose until the end of December. Some of those will be in the severely immunocompromised group that had a third primary dose. But we would be aiming to get everybody's offer out and then for people to have their vaccination very shortly afterwards. So it really is all hands to the pump. And dependent on, our incredible Welsh public for coming forwards and taking their slots. Obviously, every slot that is missed, every appointment that is delayed is a delay to the whole programme. We know that sometimes that's unavoidable. If people have infections, that's completely understandable if they're unwell. However, for many people, we really need now to make sure they understand that they need to take their slot, if possible. Thank you.
So we do hope to make sure that everybody will be able to take up that option, not just to have it offered, but to take up the option before the peak of the Omicron wave hits us. Felly, cyn diwedd y flwyddyn, fe fydd pob un yn cael cynnig y Brechlynnau atgyfnerthu. Dyw hi ddim yn gymwys I bob un I gael y cynnig yna, fe fydd rhai pobl, enghraifft sy'n immunocompromised na fydd yn gallu cael eu tan y nes ymlaen. Ond mi allwn ni wneud i'n glir y bydd cyfle gan bawb I gael y Brechlynnau atgyfnerthu cyn bod pig y don yn cyrraedd ni.
You've mentioned the staff there in particular. Where are they going to be coming from? What kind of things are going to be lost as a result? For example, is planned surgery now just suspended? And if I could have that in Welsh as well, please.
So the individual health boards will be looking at their capacity. They will be trying to maintain as much as possible of their business as usual. However, there may be some services that will be running slightly slower. All essential and urgent services will continue, of course, and we have had many offers from organisations in the NHS that work on our infrastructure and enabling functions. So many organisations have come forward and said, we would like to give you our staff, can you use them? And we'll be taking up their offers. Also, third sector organisations, we have a military aid to civil authorities request in for over 100 personnel. We'll remember how the RAF and the Army helped us so much in the first campaign. And we have also asked for help through the health boards to local universities. We know that there are medical students, there are health and care work professionals who are getting involved in that way. So there will be more workforce. Part of our problem is also to channel those new workers, get them trained, get them safely operating, but there are an awful lot of front of house functions, administrative functions, and just general patient care really that they can assist with. Thanks.
We'll obviously also be calling on our primary care supporters. There are about 16,000 people who are able there to vaccinate. And we have been having conversations with them, obviously, over the weekend. We do things very differently here in Wales. We work things out before we announce, so that's how we avoid the chaotic scenes that you've seen in England yesterday. So we plan before we announce. That's precisely what we've been doing. We are asking for support from community pharmacy, who are also ready to step up. So there are armies of people who are going to be helping out. Clearly, there may be an impact on some planned care services, but I think it's clear, we need to make it absolutely clear, what we're talking about here is a 3-week burst of activity, and then hopefully we will be able to get back to some kind of normality.
If I could have that in Welsh as well, if possible, please.
Oh, sorry. Fyddwn ni gweld lot o bobl yn camu ymlaen, gobeithio fydd pobl o ran primary care yn gallu helpu ni mas. Mae tua 16,000 o bobl yn fanna sy'n gallu helpu ni. I ni'n mynd i ofyn i'r fyddin i'n helpu ni hefyd. Mae pobl yn community pharmacy hefyd yn barod i gamu ymlaen. Ond beth sy'n glir yw, mae hwn yn mynd i fod yn waith am 2 wythnos yn unig, ac falle yn ystod y cyfnod yna, fe fyddwn ni'n gweld gofal sydd wedi gynllunio yn cael ei dorri nôl rhywfaint, ond dim ond 2 wythnos fydd hi. Can I go to our next question, please?
Thank you, Minister. Can you, this is primarily to Dr. Richardson, but if you could answer as well, please. What should people who are clinically extremely vulnerable do? There'll be a lot of anxiety there, particularly if they can't have the vaccine for any particular reasons. Should they be shielding again?
Thank you, Adrian. We do keep the shielding guidance under review continually. At present, the guidance is that those that are clinically extremely vulnerable, the severely immunocompromised, have already been invited for their 3rd primary dose. We are working through our cohorts in priority, and so those that have not yet been called will be very close to being called. And we have certainly asked our health boards to go through those priority groups. So at the moment, the advice would be that they are to do their own risk assessments when they go out, make sure that they're not going to very crowded spaces without masks, that they are trying to socialise more in ventilated spaces. And obviously, if somebody's extremely clinically vulnerable, then their friends and family have a duty to ensure that they flow before they go and make sure that they are not carrying the coronavirus to that person.
I think it's probably worth adding that this time things are slightly different in as much as we have the antiviral drugs to help us out, which wasn't the situation with the last wave of the COVID-19 wave. So yeah. I hope that will be helpful as well. Adrian, second question.
Thank you, and I think this one is probably primarily for you, Minister, but one change that has become in England that I haven't heard mentioned here is that people who come in contact with somebody who's tested positive are able to take lateral flow tests for 7 days rather than self-isolating. Is that something that you would like to see or will introduce here? Because it would be a great help for businesses.
So at the moment we are continuing with our recommendation for anybody who comes into contact with the Omicron variant should self-isolate for a period of 10 days. Clearly we'll keep this situation under review as we see increasing numbers within our communities. At the moment we're still in the kind of contain phase. We've only got 30 cases in Wales, so we'll continue with that phase for as long as we're able to, but clearly the situation may change very rapidly and we'll adapt when and if that situation arises. Bronwyn Weatherby.
Fernanda, what do you think the likelihood is now that people will be advised not to visit family or mix over the Christmas period? And do you think if you give that direction, people will listen?
Thanks very much. Bronwyn, the last thing we want to do is to cancel Christmas. I can make you, I think it's important we make that absolutely clear. But we are not currently taking anything off the table either. So the best thing for people to do in order to see if we can remain in a situation where we're all able to see each other over Christmas is to actually take precautions now, so we don't see the kind of increase in rates that we are expecting. So a lot of this is in our hands as individuals and as a community. So clearly the more you mix now, the more likely you are to contract COVID and this particular form of COVID. Certainly at the very minimum, we will be asking people to take lateral flow tests before they mix at Christmas, but that is something that they should be undertaking already, in particular if they're meeting with older or vulnerable people.
Okay, thanks. And are the NHS COVID double jab passes now worthless? Because it's now accepted you need a booster. Wouldn't it be better to have a system of proving a negative test result for entry, as even triple jabbed people can still catch and transmit the virus? That's for both of you.
Yes, well, thank you, Bronwyn. I think that the COVID pass is going to continually have to be looked at, and as this COVID-19 pandemic across the world pans out, we know that some countries have added the booster and have added an interval since the booster, and some countries are still considering introducing the pass. And we know that that is being debated even in the UK today. So we have our facility to LFT test in our pass already. We have the 2 doses already, and we will be keeping it under review.
Thanks, I've got nothing to add to that. Ruth Mazalski.
Thank you both. People are clearly trying to make their plans for Christmas, and while we absolutely accept it's an incredibly fast-moving situation, can you give us some sort of clarity on a timeline? So is there a best and a worst case scenario you're working towards? People just want to be realistic about what they can plan and what they can look forward to. Do you think, for example, we could be at a cap of people or households who can mix on Christmas Day, or travel restrictions? What are those best and worst case scenarios?
Thanks, Ruth. Certainly we will be reviewing this in our weekly cycle, and you'll be hearing about that on Friday from the First Minister. We are trying to respond in real time to the situation. If we were in a situation where we still had 30 Omicron cases in Wales at Christmas, then there wouldn't be a problem. I really doubt that that will be the situation, and that's why, to an extent, some of this is in in the hands of people of Wales, but obviously we can all do our bit to try and control this. We will try and keep our communities and our societies open because we think there's a responsibility to do that. This is not just about COVID being a harm. There are other economic harms, social harms, mental health harms that we need to consider alongside this. So it's not just a medical and an issue that we need to assess in terms of the NHS. We need to assess other issues alongside this. So I'm afraid I can't be more definitive in terms of what Christmas will look like when we're in such a fast-moving situation.
Thank you. And can we ask about schools? So there's a lot of parents already getting quite worried about January, given that some councils are talking about closing schools early for Christmas. Do you envisage, if the rate keeps going up as you're discussing, schools will remain closed for longer in January?
All of these issues will be assessed and reviewed. We're already discussing where are the risks, where are the greatest risks, what are the things that we can control as a government, where we think compliance will happen, where we think it'll be more difficult to ensure compliance. We're in a different situation now compared to previous waves. So we've got to bring the public with us on this one, and we're very aware of that, and that's why these are very, very tough calls, and we will be making those assessments as the situation changes and we see those rates increase. Dan, Bevan.
Thank you, Minister. Good afternoon to you both. This is more of a question for yourself, Minister, and to sort of pick up on a point that's already been raised, really. It is just 11 days until Christmas. People will need to know what it's going to look like. You and the First Minister have both said that more restrictions are likely. So should people start planning for the worst? They're not going to be seeing all of their family and friends on Christmas Day, but hoping for the best. And you've said you can't categorically rule out more restrictions on Christmas Day, but is it more likely that that restrictions will be coming in after Christmas rather than before?
Dan, I'm really sorry that I can't be clearer with you, because we genuinely have no idea how quickly this Omicron's going to spread. So certainly I think people should plan because we don't know what the situation will be at Christmas time. Certainly taking the opportunity to do things early, I think would be a sensible option, but we have no idea what Christmas looks like at the moment, because it's such an unpredictable situation in terms of the rates within our communities.
And with what you're saying about the expected Omicron wave coming in the next few weeks, I mean, that clearly means that time is crucial when it comes to the booster rollout. When are you expecting it to ramp up in terms of record levels? Because at the moment, the previous best day is 34,000. You've already said that you need to double your current capacity to reach the goal. So if it's not going to be ramped up that much in the next few days, then how can you expect to hit that target?
Well, yesterday, Dan, we did reach 26,000, which was really very, very good. And we're expecting to build on that daily. So our health boards are working very, very hard. We do know that they are struggling, though, with a high DNA rate, people that can't attend or don't attend. So we really would ask people to prioritise their slot. Unless you are unwell and cannot attend, please help us by trying to make that appointment. This will help the whole thing flow better, and it'll be so much easier for us all if we can get through the numbers as planned. So we are ramping up now, but we'll be ramping up more in the days to come, and obviously in the weeks leading to Christmas and the New Year. We are doing very, very well, but we need to do more. It's absolutely agreed.
And I think, Dan, it's probably worth just emphasising, we're going to do our bit here. We are going to provide the facilities and the opportunities for people to take their booster vaccination. But as the First Minister said last night, it is vital that people step up and come forward when they're called for their booster jab in order to protect themselves. 2 doses of the vaccine is not enough. you absolutely need the booster dose. So please come forward. And if you haven't had any vaccination so far, then you need to step up and to make sure that you've got some kind of protection from Omicron, because we are in a difficult situation. We don't know quite what we're facing still, but now is the opportunity. Don't leave it until the middle of January before stepping forward. Thomas Evans, Asperec.
Diolch, Gweinidog Iechyd. Yn ogystal â'r hyblyn a'r Brechlynnau atgyfnerthu, mae profi hefyd yn bwysig. Felly, sut mae Llywodraeth Cymru yn sicrhau bod pawb yn gallu cael mynediad digonol i'r profion llif-unffordd, and I adrodd yn Saesneg hefyd ar gyfer Dr Richardson. Testing is also key in addition to the booster dose of the vaccine. You are, of course, as a Welsh Government, asking people to flow before you go. We've seen instances of tests being unable to be booked online on the UK Government's website. So how is the Welsh Government planning on getting enough access to LFTs?
Well, Wales has about 21.3 million lateral flow tests available in our warehouses. We think we work out in terms of demand about 900,000 per week. We know that the UK government has requested a 200 million additional lateral flow tests, and we'll be getting our percentage share of that. So we are fairly confident in terms of the number of lateral flow tests that are available to us. There may have been an issue yesterday in terms of people seeing a sudden surge. We would ask people to use up the lateral flow tests that they already have in their homes before going out to fetch some more. But you can access these lateral flow tests from your local pharmacies. 97% of pharmacies in Wales have signed up to distribute these lateral flow tests. O, chi eisiau fi ateb yn Gymraeg wrth gwrs. Mae 21 miliwn o lateral flow tests gyda ni ar gael yng Nghymru. I ni'n defnyddio tua 900,000 yr wythnos. Mae Llywodraeth Prydain wedi gofyn am 200 miliwn yn ychwanegol, a mi fyddwn ni yn cael yn ganran ni o hynny. Mae 97% o pharmacies ledled Cymru wedi dweud y fyddan nhw'n falchu ddosbarthu lateral flow tests, ond ni yn gofyn i bobl yng Nghymru i defnyddio'r lateral flow tests sydd gyda nhw yn eu cartrefi nhw cyn gofyn am fwy.
Diolch i chi. Ac a fydd yn rhyw gyfyngiadau newydd yn dilyn system lefelau'r rhybudd Llywodraeth Cymru neu ar lefel rhybudd sero ar yr y funud, neu a fydde'r Llywodraeth yn barod i gyflwyno cyfnod clo llawn os bydde angen? Would any additional restrictions follow the Welsh Government's alert level system, or would the government be prepared to go a step further and to reintroduce a full lockdown if they thought that was necessary?
I think the Welsh Government will do what we need to do to keep the people of Wales safe. That is our primary responsibility, and to make sure that we can protect the NHS, in particular as we go into the toughest weeks for the NHS in January. It will be more difficult, of course, for us to instigate a full lockdown without support of the UK Government, and conversations are always ongoing with the UK Government in terms of what is possible, but we are still assessing the situation, but there is a likelihood that we will see some additional restrictions being introduced at the next review. Mi fydd angen i ni wrth gwrs cadw llygad ar sefyllfa newydd. I ni mewn sefyllfa lle fydd hi'n anodd heb cefnogaeth ariannol oddi o'r Llywodraeth Prydain i ni wneud cyfnod clo llawn. Ond wrth gwrs, dwi'n meddwl wrth i ni weld y ffordd mae'r virus yma yn ehangu, mae'n bosibl y fyddwn ni yn gweld fwy o cyfyngiadau yn gorfod cael eu cyflwyno yn ystod y review nesaf. Katie Hasseldyne.
Good afternoon. As so little is known about the Omicron variant, how can people be sure that coming forward for their booster will prevent restrictions being brought in after Christmas?
Can I just say, you should be having the booster vaccine not to avoid restrictions, but just to ensure that you maintain your health and you maintain the health of your loved ones, your friends and family, and those around you. The Omicron variant, we know, does not respond as well to 2 doses of vaccine. Added to that, the vaccines that many of us have been waning as time has moved on. And we now know that, 3 doses is so much better than 2. It really is important to optimise our protection and give us long-lasting immunity.
Thanks
Thank
very
you for
much.
that. And the Swansea University behavioural scientist, Dr. Simon Williams, recently said that he feared that recent political controversies will have no doubt impacted people's willingness to comply with COVID rules. How will the Welsh Government ensure that this isn't the case?
Well, I think what you need to do in Wales is to look at the example set by our First Minister rather than the example set in the UK government by Boris Johnson. I think that the public have understood the leadership of Mark Drakeford during this pandemic. It's been secure, it's been sure, it's been very cautious, and the people of Wales seem to have responded very positively to that. And so I would ask people to retain their faith in the First Minister as he navigates us all through a very difficult time over this coming Christmas. Tom Magna.
Thank you very much indeed, Minister. Good afternoon to both of you. The first question, either of you, happy for you to answer. It's a variation on the question just asked by Katie. I just want to probe a little further. As a government, you knew before Omicron that the 2 jab vaccines, AZ and Pfizer, were declining in effectiveness and therefore, in a sense, weakening your ability to battle any new variant that came along. How and why do you feel so confident that the 3rd booster jab brings the effectiveness back, if you like, when you don't know enough about the Omicron variant?
That's a good science question for you.
Yes, so Tom, it's an excellent question, and there have been some studies there have been small studies, preliminary studies, but one that has shown that the protection that is afforded by the vaccines may not be as high as we thought. And just in the last couple of weeks, also a study from Pfizer that shows that actually it is extremely good as a boost. So we know that all the mRNA vaccines provide a very, very effective boost, regardless of what you had for your primary course. And so we are looking at the science continually, and every week new evidence comes out, and that is why we're able to change our tack whilst looking at the effects of the variant on our society, on our infection rate, and on our admissions.
Thank you very much indeed for that. That came from my science background. Now from our audience. The drive for booster jabs has continued to mean that the essential support services for unpaid carers that were dropped overnight at the start of COVID have not yet been restored. With a shortage of paid care workers, the pre-COVID situation of 96% of care across Wales could now, being provided by unpaid carers, could now be much closer to 100%. So what's your message on a ministerial, indeed on a human level, to unpaid carers about the continuing loss of essential services and whole needs assessment? In fact, the lack of all that works to support physically and mentally their work, often 24/7, with no apparent end in sight on COVID. Have you.
Thanks very much, Tom. And the first thing I want to say is a huge thank you to all our unpaid carers who have done valiant work over so many years, and that has been obviously an increased burden on them during this particularly difficult time. So we're very aware of the situation, and that's one of the reasons why we have put additional financial support in place to try and help out those unpaid carers. We're intensely aware of the pressure that they're under. We're intensely aware of the fact that it is difficult to recruit paid carers to the service at the moment. We have done a huge amount of work to drive up the numbers of people entering the care workforce. We've done huge amounts of publicity to try and encourage people to do and to engage in what is a very rewarding profession. But it is really important that we support those people, of course, in this difficult time, which is why we've put an extra additional funding to put in place to get us through this winter. We've put 43 million additional funding for winter pressures to really support the care service. So some of that obviously will be earmarked specifically for those unpaid carers. Diolch yn fawr iawn i chi gyd.